Cushing's syndrome is an hormonal disorder. Look at this picture, shows that physical symptoms. CT findings. An MRI pituitary findings. Look at this. A detail going on. Introduction. Cushing's syndrome, also called hypercortisolism, is a disorder caused by prolonged exposure to high levels of cortisol. Cortisol, a steroid hormone produced by the adrenal glands, helps regulate various bodily functions. Including metabolism, immune response, and stress. Excess cortisol disturbs normal body functions, leading to significant health issue. Definition. Cushing's syndrome refers to a condition characterized by chronic hypercortisolism, either due to endogenous overproduction or exogenous intake of corticosteroids. Types. A. Exogenous Cushing's syndrome caused by long-term use of corticosteroid medications. Example: prednisone, B. Endogenous Cushing's syndrome resulting from overproduction of cortisol by the body. It can be divided into Cushing's disease due to a pituitary adenoma producing excess ACTH, to adrenal Cushing's syndrome due to adrenal tumors, adenomas or carcinomas. Three, ectopic ACTH syndrome caused by ACTH producing tumors outside the pituitary. Example: small cell lung cancer. Causes. A. Exogenous causes: prolonged use of corticosteroid medications. B. Endogenous causes: pituitary adenomas, Cushing's disease, adrenal tumors, adenomas or carcinomas, ectopic ACTH producing tumors. Risk factors: 1. Prolonged corticosteroid therapy. 2. Family history of adrenal or pituitary tumors. 3. Genetic syndrome like multiple endocrine neoplasia. 4. Smoking linked to ectopic ACTH syndrome. Complications: 1. Hypertension. 2. Type 2 diabetes mellitus. 3. Osteoporosis and fractures. 4. Cardiovascular disease. 5. Opportunistic infections. 6. Muscle weakness and atrophy. 7. Depression and anxiety. 8. Infertility. Pathophysiology. Cushing's syndrome results from chronic exposure to high cortisol levels. Cortisol increases glucose production, leading to hyperglycemia and insulin resistance. Causes protein catabolism, resulting in muscle wasting and skin thinning. Redistributes fat, causing central obesity, moon phase, and dorsocervical fat pad. Suppresses immunity, increasing infection risk. Alters bone metabolism, causing osteoporosis. The pathophysiology of Cushing's syndrome involves multiple physiological changes due to chronic exposure to elevated cortisol levels. Here is step-by-step explanation. Step-by-step pathophysiology. 1. Excess cortisol production or administration. Endogenous causes or exogenous causes. 2. Hyperactivation of glucocorticoid receptors. 3. Increased gluconeogenesis and insulin resistance. Altered lipid metabolism. 5. Protein catabolism. 6. Bone resorption. Cardiovascular effects. 7. Hypertension. Immune suppression. 8. Suppression of immune system. This leads to increased susceptibility to infections. 9. Central nervous system effects. High cortisol levels can affect mood, leading to depression, anxiety, irritability, or cognitive impairment. These pathophysiological changes collectively cause the signs of symptoms of Cushing's syndrome, such as physical, moon phase, buffalo hump, purple striae, and central obesity. Metabolic hyperglycemia, hypertension, and osteoporosis. Psychological mood disturbances and cognitive changes. This step-by-step breakdown captures the cascading effects of excess cortisol. Signs and symptoms. 1. General appearance. Central obesity, moon face, buffalo hump, thin arm and legs. 2. Skin and hair, purple striae, stretch marks, easy bruising, acne, and excess hair in women. 3. Musculoskeletal, muscle weakness, osteoporosis. 4. Cardiovascular, hypertension, edema. 5. Metabolic, hyperglycemia, weight gain. 6. Psychological, depression, mood swing, insomnia. A diagnosis. 1. Initial screening, 24 hours urinary free cortisol, late night salivary cortisol, low dose dexamethasone, suppressant test, DST. 2. Confirmatory tests, ACTH level to differentiate ATH dependent from independent causes. 3. Imaging, pituitary MRI for Cushing's disease, CT or MRI of adrenal gland for tumors, chest or abdominal image for ectopic ACTH. The nursing diagnosis. 1. Risk for infection related to immunosuppression. 2. Imbalanced nutrition, more than body requirements related to hypercortisolism. 3. Impaired skin integrity related to skin thinning. 4. Disturbed body image related to physical changes. 5. Risk for injury related to osteoporosis and muscle weakness. Management. First, medical management. 1. Corticosteroid tapering for exogenous causes. 2. Medications, ketoconazole, metirapone to suppress cortisol production, pesireotide for Cushing's syndromes. 3. Surgery, transpenoidal pituitary surgery for pituitary adenoma, adrenalectomy for adrenal tumors, for radiation therapy for residual pituitary adenomas. Nursing management. 1. Monitor blood pressure blood glucose and weight. 2. Provide a high protein, low cholesterol diet. 3. Encourage physical activity to prevent muscle wasting. 4. Protect the patient from injury due to fragile skin and osteoporosis. 5. Provide emotional support for psychological syndrome. Treatment options: 1. Surgical removal of causative tumors. 2. Medical therapy, cortisol inhibiting drugs. 3. Radiation therapy for inoperable tumors or residual disease. 4. Lifestyle modifications, managing hypertension, diabetes and weight. Psychosocial medicine: 1. Counseling and address body image disturbances. 3. Support groups for causing with chronic illness. 3. Addressing depression and anxiety through therapy or medication. Prevention: 1. Use corticosteroids judiciously and under medical supervision. 2. Early diagnosis and management of adrenal or pituitary tumors. In conclusion, Cushing's syndrome is a complex endocrine disorder requiring a multidisciplinary approach for effective management, early diagnosis, appropriate treatment, and supportive care are essential to improve patient outcomes and quality of life. Prevention and awareness are key to mitigating risk associated with corticosteroid use and early detection of endogenous causes. Thank you. Have a nice day.